The next tip for lowering hemoglobin A1C is low to moderate alcohol consumption. This is the study. It's available in the resources section in PDF format for this course. It was published in the journal BMJ, which has an impact factor of 30.22, which puts it among the most respected journals in medicine. The study was published in July 2020. This was an umbrella meta-analysis, so they looked at dozens of potential factors that could lower A1C, and alcohol was one of the few that was identified as having high quality evidence to support adoption. The study that they referred to had over 664,873 adults. The adults were followed for 3 to 19.8 years across the different studies. And this is the results. The authors found that compared to not drinking any alcohol, drinking 6 to 12 servings of alcohol per week reduced risk of developing diabetes in the follow-up period compared to not drinking alcohol. And there is some evidence that alcohol can increase insulin sensitivity. So how our body responds to insulin determines whether we develop diabetes. When our bodies are sensitive to insulin, the pancreas doesn't have to produce a lot of insulin for insulin to have its effect. When we have chronically high blood sugars and we're chronically pumping out insulin, the cells become resistant to insulin. Then the pancreas has to produce more and more insulin to allow glucose to enter cells. When that process becomes impaired with insulin resistance, we develop diabetes. So any factor that increases insulin sensitivity is going to reduce risk of diabetes, and alcohol in moderation helps. It's also shown that in excess of 12 drinks, there's no additional benefit and there's no additional harm. So drinking more alcohol doesn't either increase or decrease risk of diabetes. But all that's needed for the maximal benefit are 6 servings per week. It is important for me to bring up the literature on the effect of alcohol on mortality. Because if you just look at the literature on diabetes, you'll think, okay, I'll just drink as much alcohol as I want. And the fact is that although the diabetes literature supports that conclusion, the mortality literature does not. As soon as you reach 8 servings a week of alcohol, you start to see an increased risk of premature death in the follow-up period. And that risk gets higher and higher as you drink more and more. So the best policy to accommodate the literature on diabetes and mortality for alcohol is to limit your consumption to 7 or less per week. And if you're drinking in excess of 7 servings of alcohol per week, I recommend you check out this course on reducing your alcohol consumption.